The pancreas is critical to your endocrine system. We've talked before that it actually has two tissue types, exocrine and endocrine. You know now that exocrine means that the hormones are going to be released through ducts. And in particular, we look at the exocrine function being associated with digestion in vertebrates. The endocrine tissue, so endo is inside, which means there are no ducts. It's simply through secretion only into your bloodstream. And here we look at this associated with the production of insulin and glucagon. Again, another fabulous example of antagonistic hormones, in this case to regulate blood glucose. So the insulin is going to signal the cells to actually take up glucose from the bloodstream. The glucagon tells cells to release that glucose into the bloodstream so that we can actually store it in your liver. So we're going to work with between the pancreas and the liver to release glucose when it's needed and to store glucose when we have excess. So these two hormones, these antagonistic hormones, are going to be working back and forth to make sure that your cells and all of your body are supplied with enough insulin to take the glucose from the bloodstream and use it in cell respiration. We don't want glucose floating around your bloodstream. We need it to be in the cells, either stored for long term or being used in cell respiration. I think many of you probably know about diabetes. I want to talk to you a little bit about it because we've seen changes in diabetes over the last 20 or 30 years. Right now, we look at about 15 million people in the U.S. or 120 million people worldwide with abnormally high blood glucose levels. And what this means is the cells are not taking up glucose properly and using it in cell respiration as they should. We have got three types of diabetes. One is what we refer to as juvenile onset diabetes. This is actually an autoimmune disorder where your immune cells attack your isolate cells in your pancreas. The isolate cells are the ones that actually make the insulin. And so they attack those cells and you don't make insulin. And if you don't make insulin, then we're looking at what we call insulin-dependent diabetes, which means that if you have a prescription for insulin and you take your insulin shots on a regular basis, monitor your blood glucose, you can live a fairly normal life. Type 2 is what we call adult onset diabetes, and this is actually the majority of the cases of diabetes. And when we look at this is not a result of not making insulin. This is a result of your cells that no longer recognize the insulin that you're making. So the receptor proteins on the surfaces of your cells that would take in glucose for cell respiration have said, nope, we're not going to do it anymore. This is often associated with individuals who are obese or inactive. In 2012, it was about 9% of the U.S. adult population had this form of diabetes. So that's a huge number. Think about it. 1 in 10, roughly, individuals have adult onset diabetes, meaning that a change in diet and an increase in activity could make them no longer diabetic. This decreased sensitivity to insulin because of the changes in receptors is the key to all of this. And often, as we said, it's in individuals who are overweight. They essentially become insulin resistant, and the body stops recognizing the insulin. You stop taking up sugar from the bloodstream, and your cells are literally suffocating. They can't do cell respiration because they can't get the glucose out of your bloodstream because they refuse to recognize the insulin. Now, I mentioned to you that some individuals will actually take insulin based on this. About 40% of the individuals with type 2 diabetes can take insulin and have it make a difference. And that's because we can give you a different form of insulin. So pharmaceutical industries have looked at producing insulin in pigs and sheep and goats. And if we give you an alternate form, sometimes we can trick your body into taking up the glucose again. The bigger concern is now we're seeing adult onset diabetes in children. And in particular, if we look at these numbers at the bottom, we're looking at, in 2012, 22% of the children that have diabetes actually had adult onset diabetes. That means they were not born with this condition. They developed it over their lifetimes. And when we're talking about children, we're talking under the age of 19. So if you think about the number of children with diabetes under the age of 19, and I have here for you, we look at, in 2012, we're looking at huge numbers of individuals under the age of 19 that are overweight. So between the ages of 6 and 11, 18% of those children are overweight by definition. 12 to 19-year-olds, we have 21%. That means that nearly 40% of the children under the age of 19 are overweight. That's staggering, right? And they are directly connecting that to this increased instance of type 2 diabetes in children. Get your children outside to play. Gestational diabetes is the third type, and we see this in pregnant women. And the problem with this one is it's a temporary diabetes for the mom, but it can have huge effects on baby. And when the baby is very large, because of gestational diabetes in the mom, it can complicate delivery, puts a lot of strain on mom, puts a lot of strain on the little one.